Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the bright side of the health. I am back with today's Saturday video where mostly I do a product review or I share information about certain product that I like to use or we as a team like to use. So this is my drawer, which is a therapy drawer. Here we keep all the tools that we use at our clinic. So I am talking right now from our HealthQ rehab physiotherapy clinic in Bangalore. So this is the unit where we keep all the products. So what I am going to do in upcoming days is I'll just randomly open this drawer, pick an object that we use on a daily basis, and I'll be trying to create some information. I'll try to share some insights on why we use that device or product or whatever it is, right? So let's hop on and see what I have to show you in today's video. Alright. Okay, so what is the first thing that I got today that I'm going to share with you is this Volini gel. So again, this is not a paid promotion. I am not being paid by any company to promote this Volini gel. This is something that we use very aggressively in our center, and that's why I would like to talk about it. Now, if you have got any sort of muscular strain or pain, and if you would have gone to doctor, they would have recommended you a diclofenac gel, right? Diclofenac gel is a type of ointment that can be used to apply over a muscle which is, or as a joint which is painful. So this gel is basically that. So if we talk about the content, it has got diclofenac diethylamine IP. This is equivalent to diclofenac sodium of 1%. It has got linseed oil. It has got methyl salicylate. It has got methanol. And for preservative, it has got benzoyl alcohol, gel base, and yeah, that's it. Now, why do we use this device at our center? This is something that you can buy it and use by yourself, right? But we have a very specific use of Volini gels in physiotherapy center. And we use Volini gels for one purpose, one process which is called as phonophoresis. Now you must be wondering, what is phonophoresis? Well, phonophoresis is a process by which we can inject, or I can't say even inject, I can instill or let this gel to penetrate to deeper structures of my body. Yes, that's what phonophoresis does. So let's say if I take this gel and apply it over my neck region, hardly it can penetrate to your skin, your dermis, and to a fascia, which is a deeper layer to that, right? But if the injury is present at tendon level or is at a muscular level, how you make sure that this gel is going inside till that point? For that purpose, we use a device or else a machine which is called as ultrasound. Let me show you how does that look. Alright. So this is what is ultrasound look like. So this ultrasound is a gel. So this ultrasound is nothing but the same ultrasound unit that we see for sonography as well. The difference is in the frequency. Okay, so the sound wave frequency is different here, and this is basically used for therapeutic purpose. Now when this ultrasound machine is on, the sound waves penetrate deeper through the help of a medium. This medium is usually an ECG gel, and when we combine this ECG gel with this methyl gel or as this diclofenac gel, it penetrates deeper down with the help of the sound waves. So let's say if I have a pain here and if I apply the gel and I also put some ECG gel, and then when I am doing an ultrasound massage, what is going to happen? The sound wave will penetrate inside your tissues with the help of the gel which we have applied. So the gel will also penetrate to an extent below, and then these sound waves, what will happen is they will reflect back from the bone, because sound waves cannot absorb or cannot penetrate a bone. Whenever those reflect back, it causes, this reflection causes a micro massaging effect. It causes a very to and fro motion at the joint or at an inflamed area. It increases the blood circulation there, removes all the toxins that gets accumulated there, and thus helps in inflammation reduction. So we got two things done here. We got the effect of micro massage with the help of ultrasound, and we could also allow this gel to penetrate deeper with the help of the combination of ultrasound and ECG gel. So this entire process is called phonophoresis, and for this phonophoresis we use this Volini gel or diclofenac gel. Again, I'm saying this is not a sponsored post or anything. This is something that we usually get, so thought of sharing with you. So if you who are someone who is having injury or inflammation at joint levels or at certain point pains where on pressing you feel pain, tenderness, then ultrasound therapy is a very useful and effective therapy, because you can actually work on that inflammation level with the help of this. And the good note is you can buy ultrasound devices these days directly from Amazon, which are of 1 megahertz. So usually in clinics we have little higher megahertz machines, but for home use usually 1 megahertz machine works wonders. Even this one is a 1 megahertz machine which we also use in our clinics, and it works beautifully. So if you want to buy them, it's a one-time investment, but it's very effective and helpful to be used. On our website we have linked to the ultrasound devices. You can go and check it out, and if not, you can go to any physiotherapy center and they would be having this ultrasound device. I guess if you're watching this video, you would have seen a lot of people using, a lot of physios using this ultrasound device. So this is exactly that. So I hope through this video I could give you some information, some understanding about the products and tools that we use at our center to help patients. And if you found this video helpful, make sure to hit that like button and subscribe button. And also stay connected with us, because we have got so much of content upcoming forward in this year, which would be helpful for you to deal with your movement related challenges. Because at the end of the day, our mission is to help you move better. So on that note, I'll see you next week. Bye bye.